Good morning, good afternoon, good evening, and good night to everybody. My name is Håkan Björkman, and I'm the Regional Health and Development Advisor for Asia Pacific at UNDP. And I have the great pleasure of welcoming you all to this very important session, the socioeconomic impact of COVID-19 from an equity perspective, who is being left behind, and lessons for the future. I do so on behalf of the co-coordinators of this session, the People's Health Movement, UNFPA, UNICEF, and UNDP. We have a very distinguished panel of speakers with a great gender balance, by the way. The session is so important because COVID-19 impacts disproportionately on the most vulnerable people and groups in society. And at the same time, the responses to COVID-19, both the health response and the socioeconomic recovery programs and policies, are leaving significant segments of society behind due to misprioritization, policy failures, from which there are many lessons to be learned. And that's the objective of this session. So I will now like to introduce and hand over to Dr. Mandeep Dhaliwal, the Director of HIV, Health and Development Group at UNDP, who will facilitate this session. Thank you.
Thank you, Håkan. And welcome, colleagues from all over the world. It's my pleasure to chair and moderate this important session, which has been developed by a team of colleagues from the co-coordinators of the session mentioned by Håkan. The COVID-19 pandemic is both a public health and a development crisis. What started as a localized outbreak of a virus quickly escalated into a global development crisis of unprecedented magnitude. Measures to prevent, manage, and contain COVID have triggered far-reaching socioeconomic consequences across the development landscape, ranging from poverty, hunger, education, gender, livelihoods, the economy, to inequality, inequities, and human rights violations. These socioeconomic challenges are reversing years of development gains and threatening progress towards achieving the Sustainable Development Goals. This year, for example, we are forced to witness the first increase in global poverty since 1998, driving as many as 100 million people into extreme poverty, with the knock-on effects of that. The ongoing pandemic and its socioeconomic impacts are certainly characterized by uncertainty. However, one thing is certain: marginalized populations and women are disproportionately affected by both the health risks as well as the socioeconomic fallout of the pandemic across the world. The pandemic acts as an amplifier and accelerator of inequalities and existing injustices and the struggles faced by these groups. At the margin of global attention to vaccines and treatment of COVID-19, we have seen stories of socioeconomic injustice. Human rights violations against LGBTI people as scapegoats for the spread of COVID, exclusion of persons with disabilities from COVID-19 responses, greater unemployment risks for migrants, and many other socioeconomic struggles among marginalized populations, which in turn elevate their health risks. These stories and realities of marginalized populations must be brought to the fore. Must be brought to the fore for our attention, but also for our action. The COVID-19 pandemic has taught the world that we are as vulnerable as the most vulnerable in our societies. We've also learned this from the AIDS epidemic, and from HIV, we know that key to success is elevating the voices of the marginalized and prioritizing them and placing them at the center of our efforts and responses. That's why we're here today. The session will explore the socioeconomic impacts of COVID-19 with a focus on those at risk of being left the furthest behind, and key lessons to strengthen the resilience of the country and vulnerable community in line with the PMAC 2021 theme of advancing an equitable and healthy world. We have 4 distinguished speakers, I hope, to explore these issues together. Their biographies are available on the website. So before I introduce them, I just want to quickly run through the structure of the session. First, we'll listen to the speakers. Then we'll have a panel discussion, which will be followed by a Q&A. And I encourage all those who are listening to put their questions into the Q&A box, and we'll be tracking them, and we will come to them after the panel discussion. So please type in your questions as you listen to the presentations and the panels. So we have 4 speakers in the following order. Natasha Howard, she's the Associate Professor of the National University of Singapore. Ola Abugaib, a Manager of UN Partnerships for the Rights of Persons with Disabilities. She's my colleague based at UNDP. And Sarojini Nadimpally, who's the Executive Director of the SEMA, a resource group for women in health, which is part of the People's Health Movement. And we'll also be joined by Sabina Alkhair, who's the Director of the Oxford Poverty and Human Development Initiative at University of Oxford. Sabina is having some technical difficulties, so we're going to start with Professor Howard. Associate Professor Howard is an interdisciplinary health policy and systems researcher at the National University of Singapore School of Public Health. Professor Howard, over to you.
Thank you very much. While I get my slides up, I just want to say good morning, good afternoon, good evening to everybody. Thank you for joining us. And I hope these are clear for everybody. So since I have quite a limited time, I'm just going to get started here. So I want to spend a few minutes talking about some research that NUS School of Public Health has been involved with, either supporting UNFPA and UNICEF or through grant funding. And this has been particularly looking at the effects of household experiences and responses to the COVID-19 pandemic. We have initial data from work in 3 countries: household survey and qualitative interviews with sexual and reproductive health care providers in Cambodia, a household survey in Malaysia, and qualitative interviews in Syria. For Cambodia, UNFPA and CANA surveyed women and adolescents in households and found that households were still able to access health services. And rural households particularly reported no major changes in sexual and reproductive health service access since the COVID pandemic began. However, interestingly, lower income households had significantly lower odds of reductions in income or working hours, or maintaining only one source of income. This seems kind of strange, but what it may indicate is that these more financially precarious households have initially managed to maintain themselves, but have done so by taking on additional jobs, borrowing, or getting support, donations, etc. from family members. Similarly, high-income households in Cambodia in our survey had significantly lower odds of reporting emotional distress, mental health changes, including physical aggression or depression, since the COVID-19 pandemic began, which suggests that they may have been less affected by COVID-related stress. Again, we can't confirm this, but this is the working theory at the moment. However, women over age 25 had significantly higher odds than adolescents did of reporting worse physical and mental health, worse quality of life, and increased tensions towards their children. It's again maybe related to stress due to the fact that the family was precarious or particularly low income. So again, surveys can't tell us everything, but they give us an indication. Findings from interviews with providers help support some of the survey results, showing that despite challenges, providers maintained services provision. It was a bit slower, but they were able to maintain services. However, sexual reproductive health care providers expressed considerable concern about their own and service users' safety and the lack of sufficient PPE. Providers noted that gender-based violence responses, which were particularly asked about, were much more difficult, due primarily to women's loss of income. Thus, it wasn't actually possible to determine if GBV was worsening or not, as women stopped attending services because they did not have the discretionary income that they had previously. In Malaysia, UNICEF's research with data analytics focused on a sample of low-income families in subsidized urban housing during lockdown. These families experienced more severe declines in key economic indicators than the general population. High care burdens, childcare, people with disabilities, elders, and low access to employment-based social security. Increased financial insecurity was associated with declining food security and worsening nutrition. Female-headed households and households affected by disability experienced the most severe declines in most socioeconomic indicators. Children in low-income families experienced significant challenges in accessing online learning during the lockdown. The protracted nature of the COVID-19 pandemic appears to be impacting on the psychological well-being of these low-income parents and children as well. The Malaysian government's COVID-specific temporary financial assistance scheme was critical in sustaining a basic level of well-being during lockdown, even if it may not have been entirely sufficient. Additionally, Malaysia's strong public health system appeared to have limited the risk of increasing inequalities in health access. And thus, after the end of lockdown, some low-income Malaysian households in this survey appear to have started recovering, although this recovery is partial and towards an already deprived state, the average household income still being 10% lower than it was pre-crisis. This recovery is also uneven and uncertain, with 45% of households seeing further income declines since the end of Malaysia's lockdown, while female-headed households and those affected by disability are recovering more slowly, and household savings generally are depleted, making resilience to future shocks particularly challenging. Looking now at Syria, which is our last case study. In Syria, socioeconomic inequity concerns are most extreme. Families are already in the midst of a violent conflict that's been going on for 10 years, with COVID risk exacerbating existing socioeconomic and equity challenges. The Syria Research Group, co-hosted by NUS School of Public Health and the London School of Hygiene and Tropical Medicine, is conducting 3 qualitative COVID-related studies. One in displacement camps in northwestern Syria, one across the 3 different main governance areas within Syria, and one focused on women's experiences during the conflict and during the COVID response. Initial findings suggest that socioeconomic concerns due to the public health responses are actually much greater than concerns about COVID-19 itself. This is somewhat understandable, given the devastating effects of the ongoing conflict. Major concerns expressed in interviews were about the increased prices for essential needs such as food, the loss of already limited income due to COVID-19 related restrictions, and the impossibility of measures such as hand washing or safe distancing, as it just wasn't feasible, particularly in displacement camps. Interviewees also noted that men tended to have better access to accurate COVID-19 information, while women reported everyday sexism and the daily need to challenge patriarchal norms For example, being forced to quit their job or being fired if they became pregnant. As these kind of norms were simply no longer compatible with the harsh realities of needing to survive and support families during the conflict. So these are just very, very brief snippets of information from some of this work that we've been doing, but they do paint a picture of the extreme importance of looking at equity and looking at how this affects different people in different areas and different countries. So in conclusion, in addition to the necessary public health measures to control the virus, any effective responses must address the increased socioeconomic hardship among those who are already living precariously, and the increased mental distress and harmful coping mechanisms that may be experienced or demonstrated in some areas. Additionally, women household heads and those in controlling or abusive relationships face particularly significant challenges and may need additional support. Given these elevated vulnerabilities among low-income families in all three countries, there is clearly a need to strengthen social protection systems once COVID-19 specific interventions expire. We will come through the COVID-19 pandemic, so we must ensure that global efforts to improve equity and socioeconomic well-being are not lost in this process. Thank you very much for your attention. I'll end here also by thanking the institutions and individuals who have contributed to this ongoing work. Thank you.
Thank you, Professor Howard. I think it was an excellent presentation showing the need for more integrated health and socioeconomic development responses in the battle against containing COVID. Let's move on now to our next speaker. And it's my pleasure to introduce Dr. Ola Abwelgeb, who's the manager of UN Partnerships for the Rights of Persons with Disabilities. And she leads the UN Partnership of Persons with Disabilities and is based at UNDP. Ola, over to you.
Thank you, Mandeep, and welcome everyone. Thanks for everyone to join our discussion today. It's a pleasure to contribute to this very important discussion around the impact of persons with disabilities, specifically around COVID in the current situation, but also moving to the transition, hopefully, to going back to normal and discussing how could disability actually be addressed and considered equally to other community members. So what I will be doing today is sharing with you some perspectives of what we have seen from the ground, working with through the UN system, with organizations of persons with disabilities and governments in terms of the impact of the situation on the communities with disabilities in the countries where we operate. Starting with just explaining very briefly on the impact of COVID-19 on persons with disabilities. What we have seen from the literature that has been starting to emerge the last few months in terms of the impact is that what has been recognized in the last decade, more even predominantly, that the 15% of communities which are persons with disabilities has been really constantly suffering and have been at higher risk as implications of the COVID situation. Because as we know, persons with disabilities has higher needs in terms of access to services, specifically to certain types of health services, but also rehabilitation services and beyond. They are also, many of them, has what was called underlying health conditions, which puts them at higher risk when it comes to catching the virus. But also there were many indications when it comes to the daily impact of livelihoods, access to basic services, even in terms of access to food, shelter. We have heard a lot from testimonies from the surveys that has been conducted the last few months that this has been the case for many populations, and specifically the underrepresented groups of persons with disabilities. We have also seen that the shift that happened globally in terms of the education system to remote learning had also, unfortunately, higher impact on students with disabilities, because in many cases connectivity, availability of even laptops and technology in their households to enable them to equally contribute to and connect to the system was not possible. And that also generated a lot of higher impact on those children equal to non-disabled members in those households. We have also witnessed, and we have seen in the past, unfortunately, that in situations of crisis, humanitarian context, emergency situations, unfortunately, women and girls with disabilities are at higher risk of being vulnerable to violence. And in this situation, it was even higher from domestic incidences. And of course, what we have seen also that response to those situations has been very minimal. And that's why we are in contact right now with many countries to try to mitigate that risk on those women and try to work very closely with civil society and government to put in place some mechanisms, at least on temporal basis, to ensure we're capturing what's going on, but also we're linking them to the needed services of protection and also care as needed. Just very briefly to explain to you what we as BRBD has been doing the last few months, and to generate some learning also to you on the COVID situation. Starting from March, we as a pooled funding that provides funding through the UN system to implement joint programming, but also to provide technical assistance to countries. Many countries where we operated came to us with urgent requests to repurpose their ongoing activities, because they realized, as I was explaining earlier, that the response of governments failed disability again, and they needed to immediately connect with the government, connect with the civil society organizations to ensure access to information is adequate, the voice of the communities of persons with disabilities is heard, and the government response is inclusive of persons with disabilities. And we have done that in different modalities. Some of it was repurposing, another one is giving immediate funding support, but we also launched a global initiative through our members, which are the main 9 UN agencies that actually lead the disability inclusion work more globally, including UNDP, of course, is that we have been, and we're continuously now, developing a lot of knowledge products to provide to countries immediately to help them in the response phase. But also some of them are also tailored right now towards the recovery plans and implementation beyond COVID, because we want to ensure that what has been captured in this phase as learning from either success or failure when it comes to disability communities is learned from and taken forward in the future. We have also launched a call for proposal to countries in August, and just a little bit to shed the light to you, our focus was, of course, continuously on supporting countries to move the agenda on the disability inclusion, but also we had emphasis on ensuring that the UN system response is inclusive as well to disability, whether on the broader development agenda when it comes to SDGs, but we had also explicit attention to COVID situation. And what we received from countries as a response to this call was really, I would say between brackets, promising, because we could see that a high number of countries out of the 110 that applied to us actually had indications that they wanted systematic interventions that want to ensure governments are inclusive in their socioeconomic and recovery plans in the near future. And as part of that, because we're currently still reviewing those applications, we went to the literature and tried to understand what happened at country level when it comes to the responding to the UN framework on the socioeconomic response to COVID situation. And as we know that there are 4 pillars within that framework, which are the health, social protection, economic recovery, and social cohesion and community resilience. And what we did is we analyzed what is available in the public domain when it comes to socioeconomic impact assessments and recovery plans to see how disability was captured and try to see how our funding can actually connect to those socioeconomic recovery plans. And what we have seen is that at the level of the impact assessment that took place at country level, out of the 67 assessments we reviewed, only half of them looked at disability. And that is an indication that we still need to do more at country level, because we know that if certain community members' needs and rights are not addressed at the assessment level, that is in many cases going to be leading to a consequence that indications of their impact at the planning level will be very minor or missed completely. We also analyzed the socioeconomic recovery plans, and the findings there were a little bit more promising, but it was also the indication of the priority areas was variance from one country to another. So out of the 103 socioeconomic recovery plans we reviewed, we could see that 93 actually looked at disability. And that is, again, as I said, it is a promising indication to us. But it was also a learning for us that the more we are substantially working at systems level, at government and the UN system collectively, we will be able to ensure that communities of members with disabilities are not missed behind. In conclusion, what we have seen as learning from this crisis on persons with disabilities is that, unfortunately, as I said, it confirmed again that communities of persons with disabilities continues to be left behind, and they are out of the most at-risk members when such situations happens. And whether, believe me, whether it is the case in high-income countries or middle or low-income countries, we could see that the struggle, even though it may not be at the same level, but it was consistent in the type of challenges happened and experienced by persons with disabilities. We have seen that also there is a need for more collaborative efforts when it comes to disability inclusion at country level. And what I mean by that is it needs this inter-agency collaboration to be even strengthened further, but also this collaboration of stakeholders. And we have seen from our practice on the ground that this really worked very well when this dynamic is created, because when government, civil society, and the UN system are collaboratively working on this, then the higher impact is achieved on positive end. The last point that also I wanted to point out is actually two points. One is in relation to ensuring that the voice and the participation of organizations of persons with disabilities is guaranteed. And that is, again, not always the case, because we tend to assume that the broader civil society engagements will include those communities, but in many cases, it is not the case. And we need to ensure that we recognize those organizations and they are around the table in discussions of assessment and planning. And the last one, and actually equally important, is the issues of investment on disability. We have seen from our own even experience that funding and financial commitment globally to disability inclusion remains on the margins. And that's why also it's a key challenge to really come forward and put concrete actions at country level and ensure that wind track approach that we know works very well when it comes to disability, that the mainstream angle of interventions is disability inclusive, but there is also equal need for the disability targeted approach. I will stop here, but I would welcome any questions as needed. Thank you very much.
Thank you, Ola, and thank you for highlighting the importance of collaboration across agencies, across sectors, for really ensuring that when civil society is at the table, they're also including the issues around people with disabilities or organizations working with people with disabilities. So let me now move on to, and we've got some questions appearing in the chat. Can I just, sorry, in the Q&A box. So can I please remind people who are listening online, who are watching online, to put your questions into the Q&A box. So let's move now to Sarojini Nandanpally, who has been working on public health and women's health issues in India for the last 3 decades. So lots of interesting experience. Sarojini, over to you.
Thank you, Mandeep. Thank you, PMAC and other co-organizers for inviting me. It's great listening to my previous panelists, and there is a lot to learn in our own context too, particularly with the people living with disabilities, and I think it is an important area. Thank you very much. I just have only one slide. This is my presentation title, and it speaks a lot. I think at times the visuals can make much a larger impact, like my title is Trampling of Hope, Mockery of Justice. The crisis of migrant workers and COVID-19, this has developed by the Food Sovereignty Alliance India. So yeah, that's one slide I have. We can close the slide and I will move on to my points. Yeah, as you all know, on March 23rd, the government of India has announced overnight, without any preparation, into a period of lockdown to manage the spread of COVID-19. And I'm sure many of you must have seen the visuals of women with luggage, which has been depicted in that art, in the poster too, on their heads, a child sleeping on a wheeled suitcase while it is being dragged by his mother, a husband pulling a hand cart with the pregnant women sitting in it, a family carrying their pet dog and a duck walking. And these are the visuals which really shook the entire nation. And they were starving. Little kids are toiling behind their parents, walking for miles to get back to their villages. A woman worker set herself on a journey in an advanced stage of pregnancy and was forced to give birth to her baby by the roadside, while 16 workers were crushed by a goods train in the western province. It actually shook the nation. The migrant workers, I don't want to use the word migrants, but the migrant workers, they left cities. That is my presentation actually, which is going to speak. They left cities in huge numbers during lockdown due to the loss of livelihoods without work or wages, relief of financial support. Initially, the CSOs, NGOs were helping. And there is a widespread deprivation, fear of being infected, stigma, uncertainty on the duration and nature of the lockdown, lack of any supporting systems. So that COVID-19 actually exposed the deplorable conditions of the informal labor force in Indian cities. In India, for many of the 8.5 million women migrant domestic workers, the pandemic has led to loss of income and jobs with their health, safety, and well-being often ignored. So the economic downturn, has left women migrant workers sending fewer remittances, a lifeline for families and communities in their country, in their states of origin, especially during times of crisis. And most of the migrant workers live in crowded accommodation or dormitories where physical distancing is a challenge to implement. They have limited access to food, clean water, personal protective equipment, such as masks and sanitizers. They're often the most vulnerable due to lack of access to healthcare, housing, and social protection. They're furthermore subject to rising levels of discrimination and stigma too. We came across, initially they were even sprayed with disinfectants when they were walking and then reaching their villages, that completely violating their privacy and the bodily integrity and their human rights. And who are these migrant workers? They are, as a category, they include daily wage laborers, construction workers, factory workers, agricultural laborers, urban manufacturers, service providers, domestic workers, I can go on. The migrants, they carry the burden of India's GDP growth on their shoulders is evident from their presence in the construction industry, farms across the country, offices in the service sector, vendors in markets, in urban and rural clusters, milk, food and newspaper delivery, and factories in manufacturing hubs of the country. Post-lockdown and now the unlockdown phase, the migrant workers who went back home or they're returning back now, as well as those who stayed back, are finding it difficult to find employment. Many migrants are now jobless, may not be eligible for assistance from the government or for receiving unemployment benefits. Food shortages and homelessness are on the rise. Even after many workers return to their places, cities of work, they will be exploited because of the shortage of available labor. Journeys back to the cities to seek employment and other opportunities seems inevitable, but can the cities that have barely provided sustenance and precipitated deplorable, humiliating living conditions be transformed to become inclusive spaces that foster survival and dignity? That's my question. Unfortunately, recent trends do not indicate this and instead reflect deterioration on the recognition, exercise of people's rights. A key example is the compromising of labor laws, the sham of fiscal relief, such as announcement of a mammoth 20 million crore, US 266 billion as part of the self-reliance. Some economists suggest that far from the promised 10% GDP. So moving from the migrant workers to other marginalizations, the pandemic has transformed rapidly into a humanitarian catastrophe of an unprecedented scale globally. In India too, pre-existing inequalities and injustices, they have aggravated its impact on human lives and society. We have witnessed extreme challenges that confronted all sections of the society, particularly the vulnerable groups. However, with patriarchy deeply embedded in society, the pandemic has particularly affected women and girls in the ways that have roots in the discriminatory values and practices in critical areas of life, be it in the decision-making and control on their lives, access and control of resources, and gendered forms of violence or representation within the public systems and policies. While access to healthcare during the pandemic is often challenging, even before that, barriers to care gets aggravated when one belongs to the marginalized. There are multiple socioeconomic disadvantages that members of particular groups and communities such as Dalit, Adivasi, that is a tribal and elderly, religious minorities, sex workers, the LGBTQI community, migrant workers, and people with disabilities, which limits their access to health and healthcare. So the COVID-19 crisis and the lockdown has also had gendered impact in terms of workload and reduced economic opportunities, lack of access to health facilities, to financial and productive resources, food and nutrition, and increase in incidence of gender-based violence. We could see the communalization and racialization of the pandemic along with the fear and stigma associated with COVID. There were many reports on the violation of rights related to confidentiality and privacy of health information and status, sexual assault on women in quarantine, and discrimination against women and trans people in the prisons. The lockdown has also enhanced gender-based violence, as I said earlier, and there is a little recourse to legal and protection services. So the response has seen varied measures that have serious implications for right to consent, privacy, and confidentiality, and have caused stigmatization and harassment of affected people, particularly women and transgender, they are not only violation of their individual right, but also detrimental to the control of the pandemic. Thus, to understand the gendered implications of the COVID crisis, even from the equity lens, other implications on other populations too, it is necessary to look into the violations and sufferings in the context of the existing inequalities and at varied levels and locations. So given this inextricable linkages of various forms of human rights, it is essential to foreground the same for all the marginalized communities with varied identities and marginalization. A call for action I would like to say here is we need to have adequate measures need to be taken by the government to ensure right to dignified, decent and fair work after COVID-19 or during COVID-19 and generate employment and ensuring decent wages and safe and decent working conditions and social security are more important than ever. they have to take measures to reduce stigma and discrimination. The government need to institute gender-sensitive, rights-based policies and measures to prevent human and labor rights abuses in the immediate term, reduce the recovery costs for business with the economy will rebound, and preserve the livelihood and social benefits of migrant workers and their families in the medium to long term. What steps, if any, were advised and identified? There are many guidelines, many advisories on these issues, but it is very important, the implementation part of it. Thank you.
Okay, thank you very much, Sarojini. Sorry, I was having a little bit of a problem with my mute and video. Thank you, and a very interesting presentation about how inequities and injustices come together to affect migrant populations in India and both the economic and the social impact on those populations, and more broadly in the context of COVID. And I really also like the very strong message that's come through in a number of the other presentations about women and girls and the disproportionate impact on them. So now, last but not least, I'm delighted to welcome Professor Sabina Alkhair. Sabina directs the Oxford Poverty and Human Development Initiative, and she's an Associate Professor of Development Studies in the Oxford Department of International Development at the University of Oxford. So Sabina, over to you. I'm glad we were able to resolve the technical issues, so welcome. Wonderful, over to you.
So I'm delighted to be with you and to have this really important exchange looking at the populations that are left behind in the COVID response. What I will do now, we are focusing on multidimensional poverty. And so poor people, a number of deprivations. So we will use the global multidimensional that OFI with UNDP reports for 107 countries and 5.9 billion people. And it looks at 10 different deprivations that people might have at the same time. And it asks which of those deprivations are actually being carried. And these are deprivations in health, like nutrition, or sadly having lost a child, education, being out of school, not having any educated member, or lacking household goods like cooking fuel, adequate sanitation, safe drinking water, electricity, housing, and assets. The first point to take away is that when we say multidimensional, we mean multidimensional. That 99% of the people who are deprived in electricity, for example, are deprived in at least one other deprivation. So the lives of poor people are already complex, and they're already being left behind in different ways. So when we identify as poor people who are deprived in at least one dimension, or the equivalent weighted indicators, we find that 1.3 out of 5.9 billion people are multidimensionally poor. And half of these are children under 18 years of age. And 2/3 live in middle income countries, not low income countries. But the vast majority do live in South Asia and Sub-Saharan Africa, roughly equal numbers in both regions and in rural areas. But this year, we also released trends over time. And out of the 75 countries and 5 billion people we studied, 65 countries had reduced multidimensional poverty in the previous period. And this was fastest in Sierra Leone, followed by Mauritania and Liberia. But there was signal progress in every global region. India had the most number of people out of poverty in a decade, with over 270 million. China, Indonesia, Armenia, all of these had very fast relative reductions relative to their starting point. So there were many stories of success, but all of these data predate COVID. For all of us listening, COVID has affected our lives. It's been a shocking exposure to a new threat and changed our travel and changed our ways of working and our lives with our families. But for the poor, it is another addition to their already extensive deprivation load. So how do we use data to inform the emergency and post-emergency responses? I'll first give some examples using the global MPI, and then turn to what governments have been doing and how they are using data on poverty to redress some of the vulnerabilities. So we look at the deprivations within the MPI and these data to identify those at high risk and to see how poverty may increase. So for example, if we look at people who might be undernourished and so have a compromised immune system, or lack clean water, or clean cooking fuel, so be at risk of acute respiratory infections, we find that 3.6 billion people in the countries we cover have those, at least one of those risks, and 435 million have all of them at the same time. So these are kinds of comorbidities. Were COVID to strike them, they might have a worse course of the disease. And if we look at these high-risk people and overlay it with the MPI poor, the 1.3 billion, we find that over 1/4 of the MPI poor people are in this high-risk category, with most of them experiencing 2 or 3 deprivations at the same time. And we can overlay this with different information from COVID, as we have done here at the national level. But it really becomes very much more illuminating when we look within countries. So for example, in sub-Saharan Africa, almost all of the poor have at least one of these risk factors. But if we look subnationally, we can see, for example, in Kano and Katsina in Nigeria, the number of people who are poor and at high risk is the highest. And we look at the number, and these are useful for geographic targeting of those who are being left behind because both COVID and COVID risk factors and MPI are overlaid. And this subnational variation we have for all countries, and it varies a great deal. So the number of people at high risk can go from a very low in Côte d'Ivoire, in Abidjan, to over 50% in other regions of the country. And then I mentioned that 65 of the 75 countries that we covered had reduced multidimensional poverty, and 47 of them had reduced it fast enough that if these present trends were to continue, they would cut MPI by half between 2015 and 2030. So it was overall a positive story. But the data were collected before COVID. And so we used World Food Programme projections of food insecurity and UNESCO projections of children out of school. And we developed 6 different scenarios using microsimulations of how deprivations could have increased because of the pandemic. Overall, the years. So this very much is a sobering scenario, but in a global and positive ray of light, I mentioned that the fastest of 65 countries to reduce MPI was Sierra Leone. And it did so in the years 2013 to 2017. But those years overlapped with the times when the Ebola pandemic raged and then was brought under control from 2013 to 2016. And pandemics do not have perfect government responses, perhaps anywhere, and human error as well as tragedy seems inevitable. Let me give you just a few examples. First, multidimensional vulnerability indices are used, whether in Pakistan or in Bhutan or Iraq or others, in order to identify people who probably have been impacted by COVID because of their poverty, their informal employment, the precariousness of having an intergenerational household, or overcrowding. For example, there was a rapid remote survey in Bhutan, a country that has a lot of tourism, and it looked at the workers in tourism and allied sectors and found that 80% of those workers were vulnerable multidimensionally. And this helped to do response in terms of retraining and coping strategies. In Afghanistan, microsimulations were used to identify the households most likely impacted by higher food security or employment or lack of schooling. In South Africa, as Justin Mthembu, the minister in the presidency, said, a census-based multidimensional poverty index was used to identify areas for directing the COVID interventions. With UNDP, the government of Honduras used the multidimensional vulnerability index to target the single voucher program at the household level. And this looked at different health risks, financial consequences, and informality of employment. And so it was an index blended with social protection programs. And the final example is Colombia, which again had a recent census. They merged it with health records. They overlaid it with data on health institutions and on populations that were aged or had different vulnerabilities. And so they used this data to track, and it was done at speed. So these are a few of the ways that multidimensional poverty measures try to sensitize policymakers to vulnerable populations and inform very concrete responses. I close with the words of Sani Nishtar, Minister of Poverty Alleviation in Pakistan, at that General Assembly event on leadership and COVID. We now have a once-in-a-generation chance to build a fairer world. And COVID, in a sense, has created space for unconventional action. So she called on participants, let's not waste that chance. Thank you so very much.
Great, excellent. Thank you very much, Sabine. And I think that was it was worked out very well to have you present last and leave us with this question about, I particularly like the example of Sierra Leone and the capacity during a pandemic to do something different and to really make dramatic progress in reducing poverty. And is something similar possible on inequities in the context of reducing inequities in the context of the COVID-19 pandemic, and using this as an opportunity. So could I now ask all the speakers to put their cameras on? We've got a panel discussion. We've got a couple of questions that we'll ask the panelists, and we'll ask them to I'll just go in order. So I'm going to ask, because we've only got half an hour left, and I want to give the people who've been listening online an opportunity to interact as well. I'm going to take the liberty of really focusing on the question which Sabine ended with. And that's really, how can we take advantage of the opportunities presented by the pandemic to advance the inclusion and empowerment of marginalized communities, of women and girls, to facilitate social transformation towards greater equity, health, be that health equity or socioeconomic equity. So how do we use the COVID-19 pandemic to, as an opportunity, and a once in a generation opportunity to really drive progress on equity? So I'm going to start, I'll start with, let's go first to Natasha.
I think it's a really good question. I mean, a couple of things come to mind. One is that there's this idea that we're all in this together, which is true. But clearly, we're not all in this together in the same way. So I think it's particularly important that we think about what are things that are naturally happening and will continue to happen that may be able to improve equity. Some of, again, they're not huge examples, but they're personal examples, is just this reality of online education. Yes, there's the negative that some households cannot access it, but at the same time, there is also the positive of it opens up things like conferences such as this, or educational opportunities for people who, for example, women who have to stay home taking care of their families can join a Zoom conference. I can join this conference in the middle of the night. Other people have the opportunity to interact in ways that they might otherwise not. But again, it depends on who has access to internet. So internet becomes this crucially important currency. So how can we find ways to make sure that more and more people have access to Wi-Fi, have access to this online world that we have so completely become a part of? So there are major pros and cons to this, because it opens up vastly more opportunities for people from the opposite sides of the world or with different socioeconomic circumstances to participate and contribute on a more or less equal footing, which you just cannot do when somebody has to fly to a conference or has to attend in person an educational event. So I think this is particularly important, but again, it can turn into something that's inequitable. So it's about how we handle it and how we make sure that we focus on what are things that we can do immediately. How can we help migrants or displaced populations access internet so that they can call families in other countries? Things like that make a massive, massive difference. You know, Syrian refugees in Europe, that was one of the most important things for many people was having that access to Wi-Fi so that they could call families on WhatsApp. So that's the first thing that comes to mind for me, but I'll stop now so that other people have a chance to say something.
No, thanks. And Natasha, that's great. And I think it's a really important point that there are both positives and negatives that need to be managed. And I think the digital divide is one of those. And I think we absolutely need to close the gap in terms of access to, to the digital space, but do so in a way that doesn't increase inequity and protects. You know, we've heard lots of reports about violations of confidentiality, and I'm going to come to Sarojini because I think you picked that up in your presentation as well. So Sarojini, over to you. So reflecting on this question, how do we take advantage to advance of the pandemic to advance inclusion and and empowerment. Do you agree with Natasha? Is closing the digital divide one of the important ways of doing that? How do we manage the positive and the negative? Over to you.
That applies to the context, the local context. We live in a patriarchal society, and the access to smartphones. If I go to a remote village, it is always with the family members. A woman or a young girl will not be able to access it. So we need to think about multiple ways of communication, understanding the local context, and then that is very, very important. I cannot straight away say that this is going to help, but knowing the situation, how we can make this possible, that it is a deep-rooted problem. It cannot go away just by providing a smartphone. It has to be addressed from the basic roots of patriarchy. I just wanted to come back to your question, is that we need to put in place comprehensive, proportionate, gender responsive and context specific measures across government sectors and against the COVID-19. And it has to ensure the human rights and fundamental freedom, and paying particular attention to the needs of the vulnerable groups and people in vulnerable situations. It can be, in a conflict situation, or living in the prisons. And it has to promote the social cohesion, and then it has to take necessary measures to ensure social protection and prevent discrimination and marginalization. That is very, very important. So we have to increase in the public expenditure that leads to widespread demand side support in the forms of both increased public employment and social security, and also a basic universal income, and along with the strengthening the public health system, which is very, very important, by regulating the private sector in our country. So having witnessed these extreme challenges of varied kinds, put for varied vulnerable groups who are being affected, whether it is a migrant worker, women survivor, or gender non-binary person, or a sex worker, they were cornered in spaces which are restrictive of their gender expression. So it is very, very important to talk about what kind of, the roadmap which has been coming from the policy makers to address their context and the needs. So I'm a part of the National Human Rights Commission expert committee, which was looking at the impact of COVID on marginalized communities. And then we gave the recommendations to the governments. Government came up with 160 advisories, which are brilliant, but where is the implementation of it? I think the political will is very, very important, along with the civil society engagement and then awareness about the issue. So this is what I think will definitely protect the human rights of the people who are at the receiving end.
Thanks very much, Sarojini, and for highlighting both the importance of political will. And I think one of the things that I'm left with, 8 months in, almost 10 months into this pandemic, is really how cruelly the pandemic has exposed the gaps in social protection and social safety nets. And maybe that is the once in a lifetime opportunity that we have, is to really strengthen social protection, especially for those who are most vulnerable and marginalized. And, as we've heard in multiple presentations from you today, from all of you, it's really about, it's not just one vulnerability. Multiple, people have layered, multidimensional complexities, as Sabina pointed out, whether that's access to resources, or access to employment, or being marginalized in other ways, or whether it's because of patriarchy and gender inequality in societies. So let me come to Ola next. Your reflections on this question. How do we take advantage of the opportunities presented by the pandemic to advance inclusion and empowerment for better?
Look, for me, the timing of the pandemic is interesting, because it's like 5 years from the start of the implementation of the SDGs, and it was the pinpoint of looking at the decade of action. And it's a good moment to pause and really reflect a little bit. Have we done enough? to make that commitment a reality. And unfortunately, the pandemic proved us wrong that we didn't do enough. I speak more, of course, on behalf of the disability angle on this, but I am sure other marginalized communities can speak the same to the leave no one behind promise. Because we have seen that it is, even though on disability there was this high attention or improved attention and the narratives of the goals and the indicators, but tangible actions at country level remained very minimal. And I would see that we really need, and we have been trying so much with other partners the last few months, is we need to take the opportunity of learning what is happening now at country level, because it is a chance for us to capture evidence on failures and successes, whether even if it's small practices of good initiatives happening to ensure equity in access to certain services, or improving accessibility when it comes to access to information, or these learnings and the failures as well, as colleagues mentioned, the access to education, and it is a huge learning on both angles. On the education side, it sort of failed disability, but actually on the employment side, it proved what the communities of people with disabilities tried to prove for so many years, that we can work remotely. It is possible. So we can't claim always that people with disabilities in remote areas can't actually be productive and work in workspaces for employers from home if they are failing to have the accessible transport. So there is a lot, as I said, that we can capture and really learn from in the coming 10 years and say, okay, well, this has proved us wrong or maybe right, but let's learn from it and actually transfer the actions around the transition to the SDGs in a way that makes it a reality. And what you explained on social protection is very key, because we have seen on social protection, the movement towards inclusive social protection grew the last 5 years dramatically. Yet again, to tell you very concretely from countries, we have seen that even on the immediate benefits, cash transfers, even in-kind contribution that has been made to communities, we have seen that on disability still it wasn't the case. There was no recognition of additional cost to households with members with disabilities. Even on schemes that were targeted to persons with disabilities, they were very minimal in amount and inaccessible to most communities. And there was this false assumption that one size fits all, and the person with intellectual disability has the same needs of person with physical disability. And this interconnection between social protection and other services is still something that needs to be strengthened, because social protection will remain also with limited resources, in low-income countries. But if it's linked well with livelihoods, if it's linked well with education, with even health services, that can have higher impacts. So as I said, just in conclusion, we really need to learn to collect evidence and have a serious discussion in the coming phase where we are moving towards recovery and the new normal. What would the new normal mean to everyone? Is it just a shift back with no masks and living our lives as if nothing happened? Or actually not. There is a lot to be learned, and specifically on the most marginalized. There's actually a lot that needs to be seriously discussed by all actors.
Thanks so much, Ola. And you just listening to you reminded me also of, we talk a lot about the need for connecting the dots and integrated solutions. And I think you're absolutely right. I think we have a lot of evidence now about where we can meaningfully do that to really drive more inclusion, empowerment, and reduce equity. And, you've pointed to the need to connect social protection and HIV, and so or social protection and health. And I slipped into HIV because we've had some powerful evidence for years that giving cash transfers to young girls, to women, actually gives you good HIV prevention results. Is it being done and we've had strong evidence for a long time, and this comes back to Sarojini's point about political will. The problem is the political will to do that has not been sufficient. And one of the things that I observe in my practice around, looking at the SDG agenda is that we have an integrated agenda, but we still have governments organized in sectors and departments and ministries. And we still have civil society working on particular issues. And, so we need to find a way to bridge that if we're going to deliver on the aspirations of an integrated agenda. And I'm being a bad moderator because I'm talking too much, but let me come back to Sabina. You started us off on this question and this challenge, once in a lifetime opportunity. So how do we take advantage of the opportunities presented by the pandemic to advance inclusion and equity? And then we're going to go to the questions in the chat from the participants. Over to you, Sabina.
Great. No, thank you so much. I would say three different things. One is what you spoke about just now, the need to integrate. And in a sense, in some countries, COVID has created this remote reality, in others not. But integrating and seeing that, reducing poverty is a team sport and you need to play together in order to push the ball down the field. That kind of a thinking might seem more intuitive because we are also having to work together in new and different ways on the COVID problems or on the other responses. And so one hope is that what has been spoken about, which is working across sectors, across levels of government in a transversal, horizontal, interlinked way, would become a habit of thought that then could be used to accelerate the work on poverty. So you're working across ministries, you're trying to see, how do you use one car to bring all of the people? How do you, train people with multiple tasks so that one person can do multiple things? But a lot of these cost saving integrated on the ground activities could be useful. A second, I think, could be to recognize very quickly that we're still precarious with the recession, and so for a while we'll still be feeling a lot of fiscal pressure, and that has a lot of impact on poverty programs, and so that sort of focuses the mind. But there also is going to have to be a stimulus, and if the stimulus comes, and then if people think, well, how do we use it to make an inflection point on poverty that stays, then it could be that a one-time stimulus could again turn a corner. And I give the example in the UK where Amartya Sen wrote on the 15th of April about World War II. And in that decade of the 1940s, there was a food shortage in Britain, so they rationed. And the decade before, male life expectancy had increased by 1.2 years and female by 1.5. And the decade of the food rationing, male life expectancy increased during the war by 6.5 years and female by 7. And so it's not rocket science. It's not as difficult as a vaccine in some sense. Really simple, but emphatically implemented policies can make historic change. And so I guess that's the last. And when we had the meeting on leadership, it was beautiful. Ashraf Ghani, His Excellency, the President of Afghanistan, said, we have to listen deeply and act quickly as leaders. So I think we need to know that they have to act quickly without all the information. And so there will be mistakes. But if, like I think everybody has said, with the political will and many hands make like work, trying to create and cascade this commitment forward, hopefully there will be a change.
Wonderful, thank you. And I think this very powerful message about the need to integrate and the need to really turn that into concrete policy measures. And I think, when I think about multi-sectorality and the need to integrate, and I think we need to make, what you're pointing to is smart policy choices. And, having evidence, but we won't always have the evidence. But maybe one of the things that can be sort of at the heart of the policy choices is the equity analysis. How can we best integrate for greater equity, for greater inclusion, for really putting the most marginalized at the center of the response, not just in an abstract way, but in a very concrete way. And I think that's for me a very strong message. And there are obviously lots of things happening, which I think, Ola, coming back to what you were saying, it's important for us to collect the good practice and share that and see that scaled in different ways. So now we've got a couple of questions in the chat from people who've been listening. I'm going to ask 2 or 3 of them, and then we'll just do a round of the panelists so it gives everybody a chance to respond. So we've got a question about how do you see in practice the integrated approach to address inequity so that we're better prepared to deal with acute shocks and chronic stresses. A specific question about minimizing discrimination. What can we do to minimize the risk of discrimination about people against people who have contracted or recovered from COVID-19? And then a specific question about good practice on stopping gender-based violence against women and girls with disabilities. So one is a policy question, and then there's another question about the definition of migrant workers in India and how are issues affecting them. So that's for Sarojini. I guess everybody can speak to the how do we see in practice the integrated approach to addressing inequities. The definition of migrant workers, Sarojini, I'm going to put that over to you. What are the issues that are affecting them? And then gender-based violence against women and girls with disabilities. Ola, I don't know, Natasha, if you want to pick up on that as well. And then I guess everybody, a reflection on how can we minimize the risk of discrimination against people who have contracted or recovered from COVID-19, which we're already seeing quite a lot of, the discrimination against people. All right, so let's start with Natasha. Over to you. Any of those questions that you want to reflect on specifically?
I think some of them I already responded to in the chat.
Yes. Yeah.
So I think I am going to actually defer to Ola here in terms of to look a bit at how we can better address GBV against women and girls with disabilities, because I'd actually be really interested to hear your response to that, and then maybe I can chip in something as well from my own perspective, but I would be really interested to hear that.
Okay, did you want to come in on, sorry, before Ola, did you want to come in on the integrated approach to address inequities? Is there anything there that you wanted to reflect on, Natasha, before we go to Ola?
I think the thing with integrated approaches, we all want them, but at the same time, without quite knowing what we mean when we say it, right? So for example, it always intuitively makes sense to say, okay, we need to integrate more. We need all these different parts to be working together and going in the same direction. I don't think anybody disagrees with that. The issue that tends to happen, though, is when you get down to the coalface of that, when you get down to the front line, it doesn't always work as well as we might think in theory. So even, for example, some research was done a few years ago on integrating HIV and sexual reproductive health services in 3 different countries in sub-Saharan Africa, Swaziland, Malawi, and Kenya. And what came out from talking to women affected by HIV was that often they actually didn't prefer the integrated services. So again, that doesn't mean that integration failed. What it means is that it's very, very nuanced, and it depends what question we're asking, and it depends who we're asking. So it's not as simple to say, oh, let's be more integrated because it sounds great. It's integrating what, how, for whom, why. And I don't think we can meaningfully engage with that kind of question without looking at some of these additional complexities.
Wonderful,
Yeah.
thank you. Ola, over to you. That's, I think it's a very useful observation. Ola?
Yeah, thanks. Well, with regards to gender-based violence and disability, I mean, this has been an issue for so many years, and maybe I start reflecting with you a little bit my experience when I worked in Palestine many years ago, started to raise the attention that women and girls with disabilities are facing higher risk and they are vulnerable, and they are really facing not just, I would say, psychosocial issues, but in many cases it's life-threatening situations, because we know that there are additional, unfortunately, risks facing women with disabilities, specifically the ones who are dependent on carers within the household or in institutions, because then it's so much higher risk of even, I can tell you a lot of horrible stories and evidence we have seen and collected specifically in institutions of sexual abuse, and families tending, because of culture and belief that sterilization for their daughters with intellectual disabilities would be the best way, because they believe this is the only way to protect them from getting pregnant. So what we have seen as really the only way forward, and that has been confirmed also along my years as researcher, and now even with our programs on the ground, it will only work if we make stronger connection to the mainstream programs. So, and this is where the failure happens, is we can see that there are quick fixes by the disability service providers or the disability community to tailor something that is outside the mainstream system for women with disabilities. And of course it will not work, because it's in terms of sustainability, in terms of government's commitment to that, it will not work. So in many cases it ends up programs related to development funding that ends up, and once that program ends, the situation reverts back to the bad. And that's why, as I said, so this is one reason, is that government doesn't look at disability systematically when it addresses those issues. So that's one problem. We have visited a lot of those shelter homes provided by ministries of social development. I remember in Morocco, when I worked there, I went and visited some of these homes, and it was astonishing that, of course, none of them are accessible physically, so that's a starting point. But even the personnel and the director were saying, we can't take the responsibility. It's not by law enforcing. There is no system in place. We are not fit. They have to be gone to rehabilitation centers or any disability-related centers. So that's one reality. It's the government. The second reality is that whether we like it or not, unfortunately, the women's movement still does not predominantly address disability when they look at gender-based violence reforms and they push for things. There is a slight improvement the last years, but it's still split. And the more it continues to be split, the higher the continuation of the realities on the ground will continue. So that's why I really believe the only way is to center our attention of being inclusive when we work on reforms, when we work with civil society on issues of gender violence, and make sure that women with disabilities are at the center of the discussion, because they are the only ones that will tell us the real story on what is happening with them, what's working well, what is not working. Because as I said, there are so many assumptions of best practices from the outside community, but actually it's all about the real life experiences. One and small story I end up with is when I worked in Palestine, there was a woman with a visual impairment that she was hit by her brother constantly, and she came to us for protection because we were a women with disabilities organization. And we, of course, we supported her, and we said the best thing is to go and report him to the police. And when she went to the police to report, the police said to her, well, he's your brother, so he's entitled to beat you, so we have nothing to do with you. So that's, again, it has to do of the attitude, the culture, the understanding. Also the stigma and discrimination against women with disabilities is a big issue here, because there is this assumption that they are undermined, they are dependent, they can't report, they can't be empowered in a way that they can voice, even when situations that it occurs to them.
Great, thanks so much, Ola. So Sarojini, just specifically on the question of migrants, because we're down to the wire now. I think we've got literally about 2 minutes. Sorry about that, bad moderation on my part. What is the definition of migrant workers in India, and how?
We have any, one standard definition. If you go with the different legal frameworks you may have, but for me, we often carry multiple identities. Some make us vulnerable, while others may be the source of privileges, power, or security. The migrant identity, it can be brought within that this fold. Our cities become home for many persons who are migrants, so-called. And the definition through their mobility, for employment, which is very interesting to observe. But it is only for some and a certain class of people and lives that the burden of this identity has fallen upon overwhelmingly. That is making us witness in this humanitarian crisis in our country that is unprecedented as an outcome of the pandemic. So I can tell you, in Kerala, they are calling guest workers. They don't use the word migrants. So that is quite interesting. Yeah. Thanks.
So just one more question, which was that, do the issues that are affecting these workers during lockdown, are they different from the issues affecting the informal labor sector? If you say, or because often they're talked about interchangeably, I think.
Absolutely, it aggravated the situation, and then the unpreparedness and followed with the uncertainty has actually created that kind of massive movement of the migrants going back or now returning to the cities. So I think it is something which we need to locate, like on the previous situation, and how it has been, increased much more with the pandemic now, and with the, the economy falling down, which is very important to, link it up with that and then address the issue as a whole, not just one aspect of it. It needs a comprehensive approach from a, political economy perspective, along with the, addressing the social determinants and, informal work, because one step ahead. And we also have seen the changes in the labor laws, which are extremely, problematic too. At the same time, we have advisories which are talking about the provisions for the migrant workers. So there is a paradox. I think it is very important.
Contradiction there. Yeah. Interesting. Thanks very much. Sabina, last word to you, and then I will wrap up very quickly. What a rich discussion. Thank you. So any reflections on any of the questions that are raised in the chat?
I think on COVID discrimination, it's really all of our job. The contexts are so different. In countries where there are few COVID cases, you can identify each one. In others, it's quite massive and socially accepted. But I think what strikes in my mind is where there's a strong society, then if there are accusations or if there are prejudices that come up, then some voice on social media or some voice in a public space will counter them. And so I think it's that vigilance and that habit of always looking out for the kind of voices we've been talking about all evening and confronting them in an articulate, reasonable way, which is the only way that we can respond in an evolving situation. But it's a very good question.
Wonderful, thank you so much. I think we've had great questions in the Q&A, and really I want to congratulate the panelists, because I think it's an incredible set of presentations and body of work together, which really send a very strong message that there is an opportunity to really do something about existing inequities, which have been made worse by COVID in many ways, by being more urgent and thoughtful in terms of integration, in terms of making connections, in terms of joining forces across causes, and that there is an opportunity in this crisis, as with all crises, to come out in a place where we can be more inclusive, where we look at being more empowering of marginalized populations, and addressing some of the systemic inequities that have made the burden of the epidemic more acute for them. With that, it's impossible to sum up, actually, I think, what is a rich discussion, but I hope people will go away thinking about what is the opportunity here for us to do something differently to address inequity. How can we use this pandemic? And I think we've heard a range of interesting insights and pieces of evidence and good practice from our presenters. I want to thank them very much. And now I want to ask everybody to go to the poll. There's an evaluation. I think hopefully our organizers will put them up on put the evaluation questions up on the slide. So we're always thinking about how can we do better. So please rate the webinar in terms of usefulness, and whether the material presented was discussed well. Learning experience for all of us. So I think there's 4 questions. We've got 2. And the third question is, was the webinar engaging and interactive? And was the time available for presentations and discussion adequate? I never think we have enough time for discussion myself. And did you have any difficulties participating in this webinar? Are you interested in participating in future webinars? So the organizers will collect that information. So with that, I want to thank the panelists, thank everybody. We've got over 60 participants who've been with us through the course of the session. Thank you very much for your attention. We hope that you found it useful. I know there were some questions about whether the presentations would be made available, and I hope that our colleagues at PMAC will be able to make those available to you. But thank you very much, and hope to see everybody again in other sessions and to continue the work. Be well, stay safe, everybody. Thanks, everybody. Bye-bye.